for the topic quantitative and comparative evaluation of apical extrusion of debris, irrigating solution, and microorganism using manual and various rotary instrumentation with two different irrigation technique. This is an ex vivo study. Root canal procedure is extremely common dental practice and encountered during the in the dental field, and patient come with a swelling during or after the root canal therapy. What is the reason behind that? The prevalence of such pain was about 40 to 65% in first 24 to 48 hours. That is reduced to 11% after 7 days. Incidence of such pain was reported up to 21 to 40% by other researchers. Now, why there is lack in root canal therapy? The success of root canal therapy. Success of root canal therapy depends on so many factors like accurate diagnosis, treatment planning, knowledge of tooth anatomy and morphology, debridement and disinfection of the root canal, obturation, and finally coronal seal that gives to success of root canal therapy. In this protocol, research protocol, we are focusing on debridement and disinfection of the root canal system. Nowadays, root canal system is debrided with hand instrumentation, rotary and reciprocating instrumentation, while disinfection is done with different types of chemicals. There are different varieties of delivery system, and after the irrigation, complete removal of the disinfecting solution from the root canal is required. Despite the correct access opening and strict control over the working length, still the reported incidence of flare-up is about 1.4 to 16%. This is why? Why? Because of this periapical expulsion, and this occurred because of the instrumentation. When we are doing instrumentation, there is infected debris, irrigating solution, and microorganisms are expelled beyond apex during instrumentation as well as irrigation of the root canal system. That is often overlooked by the practitioners. How this happens? During instrumentation or during patency checking of the root canal, we go beyond the apex, or during instrumentation also we extrude this material beyond the apex, causing periapical expulsion. So, what are the sequelae of the periapical expulsions? These iatrogenic factors induces inflammation in the periapical tissue, leading to vasodilatation, vascular permeability, exudation, and edema formation in the periapical region. That leads to compression of the nerve ending and pain generation occur. Some chemotactic factors also release in the periapical region, causing intermittent pain and flare-up. So there are different instrumentation and irrigation techniques and we are doing nowadays, like hand instrumentation for the patency checking, various rotary instrumentation like prototypal instrumentation, commonly used instruments used by the operators, single file reciprocating instrumentation like a wave 1 has a forward and backward movement, and side ventilated needles are used for the irrigation purpose. But there are drawbacks with these techniques, like hand instrumentation gives maximum periapical explosion as per literatures. It is time consuming. Straightening of the canals and perforation formations are the errors occurred in the hand instrumentation. Prototypal instrumentation also gives periapical expulsion, but it is less than hand. But there are other factors, there are other errors like instrument separation, cyclic fatigue, and canal transportation sin. Wave 1 instrumentation also gives periapical expulsion, but is less than hand. Still, it is single file system and it is a less flexible. Needle irrigation has a drawbacks, like it has a positive pressure technique and it causes wedging effect in the canal. So what is the alternative for this technique? Flexicon rotary instrumentation, as marketed in the India and Asiendo in the United States, has a incredible flexibility, better cyclic fatigue resistance, no shape memory, and no canal transportation. And it also has parabolic cross-section so as to prevent strip formation. Along with endovac irrigation system can produce less periapical expulsion. So research should be carried out to invent which instrumentation with irrigation can minimize above problems. That is a need for our study. So research question for my study was whether this Plexicon instrumentation along with endovac irrigation can reduce this expulsion. So null hypothesis for my study was we assume that none of the instrumentation gives periapical expulsion like hand instrumentation, rotaper instrumentation, wave one and Plexicon instrumentation. So aim of my study was to quantitatively analyze debris irrigating solution and microorganisms using two different irrigation. So objectives for my study, quantitatively and comparatively evaluation of apical extrusion debris for the above instrumentation. Inclusion criteria for my study are permanent teeth with single-rooted and patent oval canal are selected for the study. Mature apical curvature between 0 to 15 degree and apical diameter confirming or about 15 K file is included in this study. Exclusion criteria are teeth with cracks, carious teeth, calcified resorbed teeth, canals with more than 1.5 millimeter apical diameter, curvature more than 15 degree, prosthetic and endodontic post and endodontically treated teeth are excluded from the study. Material method for my study. The study was done in Pacific Dental College, Nair Dental College, Rajiv Gandhi Medical College, and Institution of Chemical in Technology, Matunga, Mumbai. This is approved by Pacific University and its Institutional Ethical Committee of Nair Dental College. Sample size for my study was coming to 59.9. So about 100 sample per group we have selected. We have taken 4 groups, that is 400 sample, and 10 teeth will be selected as a control group. All these teeth were disinfected and sterilized in saline solution until use. Access preparation and working length is obtained up to 19 mm. Appendix tube was used to collect the extruded debris irrigating solution and microorganism, and it is weighed on the precise microbalance scale, and it is recorded. Now another extra lead from the another appendix tube was obtained to adjust to mount the tooth. Tooth is then mounted on the appendix tube lead. So alongside 26 gauge needle was passed so as to balance the internal and external pressure and also allowing the apical extrusion during instrumentation, and cyanoacrylate gel was applied to obtain a fluid tight seal during instrumentation. This 30 ml of glass vial is obtained and it is used to hold this appendix tube in the center of the cork. Tooth were then painted with nail varnish except the apical foramen so as to assure that the apical extrusion is was done through the apical foramen only and none other than that. And the rubber dam was applied on the tooth as per the diameter of the tooth so as to blind the operator during the procedure to avoid the bias. All this apparatus was gas sterilized in the ethylene oxide gas sterilizer for 15 hours. Enterococcus faecalis microorganism was used in this research protocol. The broth of E. faecalis was prepared and it is transferred into each canal with precision micropipette, and bacterial inoculation was done in the incubator till the bacterial count is about 1.5 into 10⁸ colony forming unit per mm, as this is the count obtained in the infected root canal. simulating the clinical condition. There are four groups of the instrumentation. Like manual instrumentation is done with H and K file. Portable instrumentation is portable rotary instrumentation. Group 3 was wave 1 instrumentation, and flexible instrumentation is the fourth group. Endovac irrigation is done in each group for half sample, and irrigation, conventional needle irrigation was done in the half samples per group. All this procedure is carried out in the class 1 laminar airflow cabinet to prevent the contamination from the environment. Appendix tubes where collect this debris, irrigating solution, and microorganisms. These debris and irrigating solutions were weighed and obtained. The weight is obtained, and colony forming unit are cultured on the BHR agar plates. Data were obtained, and it is subject to statistical analysis like student t-test and ANOVA test. The results were obtained. All samples shows apical extrusion of debris, irrigating solution, and microorganism, except the control group. Table number 1 shows manual instrumentation with conventional irrigation shows maximum, while flexicon instrumentation with endovac irrigation shows minimum. Irrigating solution was more with manual instrumentation with conventional needle irrigation, while flexicon instrumentation with endovac has a least. Colony forming unit for the manual instrumentation with conventional irrigation has a maximum number, while flexicon has a less in case of endovac irrigation. Colony forming unit, these are the samples obtained for group 1, like manual instrumentation for conventional needle irrigation, for endovac irrigation, rotary instrumentation, conventional irrigation, and endovac irrigation. For group 3, that is wave 1 instrumentation. Group 3A is conventional needle irrigation, endovac irrigation, and last is flexicon instrumentation has a least amount of the colony forming units of bacteria. Control group doesn't show any colonization of microorganism. Graph 1 clearly shows there is maximum amount of extrusion of debris with manual. Group 2 shows maximum amount of irrigating solution obtained in manual instrumentation, and group 3 shows list with flexicon endovac irrigation. Coming to the discussion, all experimental instrumentation systems show periapical extrusion of debris, irrigating solution, and microorganism, except the control groups. Hence, null hypothesis was rejected. Study model for the research protocol was similar to Mayer's and Montgomery, like this. Uniqueness of study. There is no comparative study in the literature showing comparison of two irrigation system with flexicon NITA instrumentation system. Apical extrusion of debris for my study is least with group 4B and most with group 1A. The reason for this is heat-treated nickel titanium flexicon file has greater resistance to cyclic fatigue, remarkable flexibility, and cross-section, parabolic cross-section. Hence, there is a less debris formation and less extrusion beyond the apex. Parabolic cross-section transfers the debris coronally rather than apically. The order of sequence from flexicon to wave 1 to rotaper to most is manual instrumentation. Apical extrusion of irrigating solutions least for group 4B and most for group 1A. The order of sequence is same. Endovac irrigation shows least than the conventional needle irrigation. Same with the group apical extrusion of microorganism, like minimum for group 4B and maximum with group 1A. Compared to other studies in the literature, many supportive studies are there in the literature except one contradictory study. There may be difference in the method of the mode of debris collection and type of tooth used in the study. Compared hand with portable instrumentation with other study in the literature. There are also so many studies which have similar findings. There is only one contradictory study that portable rotary shows more expulsion than the hand in one study only. Comparison of hand with woven instrumentation. This is an agreement of Silveria CMM et al. It's because the hand instrumentation has a more contact with the tooth and it causes piston and pumping irrigating solution and debris apically. Second reason may be a pull-push motion of the file create the pressure in the apical region. There is no contradictory study till now. When hand instrumentation is compared to the flexicon instrumentation, more apical extrusion with hand than the flexicon. Comparison of manual instrumentation with endovac. Manual instrumentation with endovac. Hello. Manual instrumentation with endovac has less expulsion than manual instrumentation with conventional needle irrigation, as endovac has a micro and macro cannula that did not extrude anything beyond the apex. No quantitative studies. Comparison of protaper with other groups. Protaper and wave 1, when compared, the protaper, in my study, protaper gives more expulsion than wave 1 instrumentation. As the wave 1 instrumentation is a reverse balance force technique kinematics, and so it is pushing less debris comparative to the protaper. There are certain studies which are in agreement with my study. Contradictory studies. There are some contradictory studies. The explanation may be a different techniques used. Comparison of protaper with wave 1 for the endovac irrigation. In my study, protaper shows more expulsion than wave 1. When protaper compared with the flexicon instrumentation said gives less expulsion than protaper. Comparison of wave 1 with flexicon. Flexicon gives less debris than the wave 1. Comparison of the apical extrusion of microorganism among the groups. Hand instrumentation shows more expulsion than engine-driven instrumentation. There are certain studies which are in agreement with my study. There is no contradictory study till date. Comparison of protaper instrumentation with wave 1 instrumentation for the apical extrusion of microorganism. In either of the irrigation, more number of bacterial expulsion with protaper than wave 1. There is no comparative study in the literature. Comparison of protaper with flexicon for microorganism expulsion. More with wave 1, more with protaper. Comparison of wave 1 with flexicon. Wave 1 shows more expulsion than flexicon. There is no comparative study in the literature. So coming to the conclusion, flexicon nitai edge endo file shows least debris irrigating solution and microorganism compared to the hand, protaper and wave 1 instrumentation. And endovac irrigation shows less debris expulsion than conventional needle irrigation. So the operator should choose wisely their instrumentation during procedure. This is the cross section of the hand instrumentation like K file and H file. This is a cross section of protaper. There is a convex triangular cross section. Wave 1 shows coronal cross section like convex triangular, same. But the flexicon has a parabolic cross section. It prevents the expulsion of debris beyond the apex. These are some publications regarding my research protocol. These are my references. Thank you for patiently listening. That's all. Thank you so much. Hello.